All right, we're live. At least I'm live, and I hope you're all alive and watching and laughing. Me and my chins. Ugh. Ugh. Anyway, be that as it may, we are pushing forward, and today we are talking about external parasites. So, if you don't recognize me, know me, I'm Dr. Gray from the SNiPit Clinic. All right. So, first external parasite up today is ear mites. Dogs and cats can both get ear mites, although we see them much more frequently in kitties. This is a direct contact transmission. So that's how they pass from animal to animal. They are mostly confined to the ears. Sometimes if they're super bad, you can find them elsewhere on the body, but most often in the ears. Some cats are really tolerant of them and don't scratch at all, and some actually, injure themselves scratching because they're in so much distress. So the ear mites, feed on the lining of the ears. They're going to poop out, ick and blood, and so you get a lot of dark debris in the ears. And a super infested cat can actually have up to 1,000 mites in each ear. That's crazy. So ear mites very easily treated. There's any number of topical products that work very nicely for that. So much for ear mites. So we're moving on to fleas. Those of us in Florida, congratulations. We are the flea capital of the United States. Interestingly enough, the majority of flea research in this country is done in Florida. There's a guy, Dr. Dryden, who actually got his PhD in parasitology at my alma mater, Purdue, and he is like the guru of fleas, and he comes every year to Florida to continue doing flea research. So that being said, it is a word to the wise that if you have an animal in Florida, they ought to be on some kind of flea prevention. So, contrary to popular belief, the adult fleas stay on the host animal. They don't hop. It's not like, oh, I'm on this Shih Tzu, but ooh, that Doberman looks really juicy, so I think I'll hop on over there. No, not happening. So, those guys, the adults stay on the host. The adults lay eggs. Those eggs are oval and pearly white. They are deposited onto the animal, and then they fall off into the environment. So environmental contamination is where you're getting, the fleas onto your animals. So if those eggs are in a suitable environment, usually if it's outside, cool and shady areas, and indoors in carpets, under your furniture and along the baseboards, those are all really nice places for flea eggs to develop, and then they hatch into larvae. So larvae are maggot-like. They feed on adult flea feces, organic debris, the eggshells from the fleas, and other flea larvae. They're kind of cannibalistic. So then those larvae are going to form pupae or little cocoons, and those can survive for up to 30 weeks. So that's a long time. We're not talking 30 days. We're talking 30 weeks. 4 times 7, 28. So 7.5 months. That's a long time. That's why if you've got a flea problem, you're just going to have to tough it out for a very long time. This is why we like prevention, because if you've ever had a bunch of fleas, then that's not pleasant. I've done that. Not fun. Okay. So as fleas feed on your pet, they're okay. I'm back. So fleas are feeding on your pet. They're gonna excrete out some kind of bloody fecal matter that looks like it's very dark brown in color. If you get it wet, it's it's going to turn red because of the blood in it. So that's a very good way to find out, if what's on your pet is dirt or flea dirt. So get it wet, especially on a white paper towel. If it turns red, it's fleas. All right, so let's say your animal has gotten fleas. The adult female flea is going to start producing eggs within 24 hours of being on your pet. And those adult females can lay 40 to 50 eggs per day. So you can see how easy it is for the problem to multiply. The adult fleas will survive 2 to 3 months. So if you've got a very heavy infestation of fleas on the pet, that can lead to iron deficiency anemia and death, especially in susceptible pets. So like the very young, so neonatal puppies and kittens, debilitated older animals, those are the ones most likely at risk. The other thing we tend to see in some pets is that they don't tolerate fleas very well. And then they get what's called flea allergy dermatitis. And so those guys are super, super itchy all the time. Most often you see it on the rump area. That's the prime real estate for fleas. But depending on the animal, you can see it almost anywhere. But the rump is the primary place we find it. So those guys are very, very uncomfortable. And it doesn't take a lot of fleas. I know when I was in private practice, pardon me, I would have, especially in my cat practice, we'd have people come in and I'd say, boy, that sure looks like fleas. And they would swear up and down they didn't have fleas. And we could comb those cats. And sometimes you'd have to comb them for a very long time. And maybe you would find a piece of flea dirt or a flea if you were lucky. But the thing of it is, with flea allergic animals, they're so uncomfortable that they're going to itch and scratch and lick and bite until they get those fleas off of them. So those guys, it's not that uncommon to not actually find the living flea on the pet. So just keep that in mind. It's like I used to tell people, if you're allergic to strawberries, you don't have to eat the whole quart to have symptoms. You eat the one strawberry, you're miserable. That's the same kind of analogy. All right, so much for fleas. Flea prevention is a very good thing. I probably have mentioned this before. There are a lot of over-the-counter flea medications. You will see names you recognize, Advantage, Frontline, those things. Yes, they work, but if you want the absolutely most effective products, those are going to be in the veterinary market. The reason for that is that fleas, any parasite adapts to what we're using to try and get rid of it. So fleas are very adept at becoming resistant to whatever we're using to get rid of them. So as products are developed, the veterinarians, we get the latest and greatest and most effective. As they start losing effectiveness, those products are put out into the secondary market. That's why you can get them over the counter. So yeah, they'll work. They just probably won't work as well as what you can get from your local veterinarian. Okay, get off that soapbox. All right, moving right along. We are going to talk about mange mites. So the first one I'm going to talk about in dogs, Demodex is one of the two common forms of mange in dogs. Hang on. So the Demodex mite is considered a normal part of the skin. We have them. It's sorry to tell you. We have Demodex mites, cats have them, dogs have them. So the only time it's a problem is if they get to be in an overabundance. And so in dogs, you can see this as little patches of hair loss, or it can be a generalized whole body thing. The patchy hair loss form is normally seen in the young pups. They can sometimes grow out of that. Generalized Demodex is a little different in that, my phone is, okay. So the generalized Demodex normally has some kind of underlying systemic disease in the pet or an immune system dysfunction to allow those mites to overpopulate. This is not a contagious mite. So you have a dog with Demodex and you have another dog in the house, it's not going to pass dog to dog. There are, thankfully now, some really effective treatments available. Bravecto being one. You can give it, it lasts 3 months. It's wonderful. When I got out of school way back in the mid-'80s, Demodex was hard to treat. We had to use things that were toxic, and it was not pleasant at all. So we made a lot of progress, and it's great for our pets. So we used to not think that cats could get Demodex, but there has been Demodex documented in cats. There's actually 2 different forms of that mite in cats. Again, like dogs, it can be localized or generalized. It's often kind of hard to diagnose in cats. And again, it's thought, if you have it generalized, thought to be related to underlying systemic disease or immune dysfunctions. So sometimes that can make for a really, really, really itchy cat. And if you do all the normal things and you have good flea control, and that's not an issue, Demodex is possible. It's not common. There are no labeled products for treatment at this time. We used to treat it in my cat practice with lime sulfur dip, and that's really obnoxious. So hopefully you never have to deal with that one. Okay, Sarcoptes. This is the other mite. Again, it's both dogs and cats. People get it. So Sarcoptes is the mange mite in dogs that is contagious. This is also called scabies. The mites burrow under the top layer of the skin, and that leads to really intense itching. And so the mites that are in the burrows under the skin are going to lay eggs. Those eggs hatch in the burrows, in those little burrows, and then they cut through and they make new burrows and more eggs. And yeah, it's bad. So that's a direct contact spread. Most often it's seen on the margins of the ears, also on the elbows and the hocks, which is the ankle part of the dog. Those are the common places. It's very, very, very contagious. You can get it as people, so you really want to make sure you get those guys treated. So cats also have a Sarcoptes mite. It's in cats. It's called notoedric mange. Very, very similar. Usually starts usually seen on the edges of the ears. I've seen a few cats that have it almost whole body, and I can't imagine how miserable that must be. It does respond to treatment. Revolution Advantage Multi will treat this. It does need to be given at least twice at 2-week interval. So, all right, so that's Sarcoptes. Then we're going to move on to lice. Okay, so the first take-home message with lice is lice are species specific. So if your dog or cat has lice, you can't get it. The cat can't get the dog lice, the dog can't get the cat lice, you can't get the cat lice, the whole thing. They're adapted to the diameter of hair, so it's very specific, and so, don't freak out. So this is another, pardon me, direct contact spread parasite. The adults actually attach themselves to the hair at the level of the skin. They lay eggs that are called nits, and they kind of glue those to hair shafts. So, especially if you have a dark-haired animal, you're more likely to see the nits. They're very small and white, and they're stuck to the hair. In cats, we tend to see it most like when we're shaving for surgery, like in the inguinal area and the groin. So that's where we tend to find it most often. And my technicians are like super good at it now. They're like, oh, this one has lice. They don't even have to look under the microscope. They can they're on it. So definitely, this is also treatable with Revolution. I need a couple of treatments, a couple weeks apart. So that's lice. And then we're going to do ticks. So ticks there's multiple numbers of ticks that that can get on dogs and cats. They are blood feeders, as you know, so they'll attach. This is the females. So the females attach, they're the blood feeders, and then they blow up like little balloons, and they will eventually fall off unless you find them ahead of time and get them off. So the problem with ticks, other than, being blood feeders, and depending on where you are and how diligent you are, a lot of ticks can be as bad as a lot of fleas. I know when I was down in Nicaragua doing work for World Vets, we would see dogs that literally had hundreds and hundreds of fleas attached to them, and it was just amazing. I'm surprised they were still walking. So the other problem with ticks is they can transmit a number of rickettsial diseases, Ehrlichia, and Lyme disease. So that's another good reason to, if you're in an area that's prone to ticks, or you find ticks on your pet, to use some kind of product that that will be effective against ticks. So I know there was a question about the difference between ticks and deer ticks. There's not really a difference. The deer ticks are a type of tick. They are very, very tiny. That's the big problem with them, in that they're rather challenging to find on animals, even when they're engorged, because of their small size. But deer is the primary host for them. They are the ones that will transmit Lyme disease. The question also was asking if NexGard was effective against deer ticks, and the answer to that is yes. So if you have a product that says it does flea ticks, you can always look it up online to see just what it all covers. The other interesting disease that ticks can transmit is called tick paralysis. This is a toxin, actually, and it causes an acute ascending paralysis. So those dogs present with sudden onset of not being able to use the rear limbs. They start out kind of weak, and then they actually can't use their legs at all, and it will continue forward up the body. A lot of those dogs end up needing some ICU care, and but you have to get the tick off. If you don't get the tick off, then it's continuing to put toxin into the system. So I haven't seen that one since I was in school, but it's still out there. And that's ticks, so we don't want ticks, lice, mange mites, fleas, ear mites, all that stuff we can prevent, and prevention is always cheaper in the long run than treatment. Just saying. Okay, I was also going to talk a little bit about ringworm, even though it's not a parasite. It's a fungus, the fungus among us. And so ringworm is a direct contact problem. It also active ringworm will produce and shed spores into the environment. So environmental contamination is also a problem. You don't have to have direct contact to pick up ringworm. So the typical ringworm lesion is relatively circular with kind of a crusty outer edge, sometimes red, sometimes itchy. But that said, it doesn't have to look like that. Ringworm is like the great pretender. So it can look like almost anything. It can be anywhere on the body. Best way to diagnose it is to put it in a culture, and it grows pretty easily. So that's how it's diagnosed. If it's just one little localized spot and you're really careful, you can probably treat that topically. One moment. Most effective is oral treatment, but that is a long-term thing, at least. Let me think how we used to do it in my cat practice. I think we used to treat those guys for 6 to 8 weeks orally, and then they would have to have 2 negative cultures before we would say, okay, you're good. So it's really a nuisance to get rid of. Hangs around the environment a long time. And so again, try to avoid getting exposed to that. We can definitely get ringworm, so most people who have worked in the veterinary industry have had that lovely problem of getting it and getting rid of it. So, all right. Sorry. One of these weeks I'm going to stop coughing. And I don't have the crud, just saying. So, I think I am done talking. And as I always say, I'm going to time 2 minutes for questions, and I will watch the questions if they come in. I'll try and answer those, and I will threaten, as I do every week, to tell bad jokes or sing. Ooh. All right. So what do you call a cow that doesn't give milk? An udder failure. That was utterly bad. Sorry. I have to tell you. Oh, the topic today was external parasites, Miss Kayla. So, no, external, the ones on the outside. Last week I did internal, so if you're really dying to know about that, you can look us up, farther down our page on SNiPit. So, tell you, it is really weird to have to look at yourself on Facebook Live and for these weird 2 minutes. So I guess I would also say that since I don't have anything better to do right at the moment, if you have questions other than external parasites, we can address those too. Oh, okay. What areas of the dog do ticks tend to attach themselves to? Ticks, they kind of like little crevice-y places. So under the collar is is a place I always look. The ears, both sides, look on the top and the bottom, in between the toes, in the armpits, in the groin area. So all of those little cozy places tend to be where ticks like to go, although they can be anywhere on the animal. Okay. Okay. So I have another question. My cat has slight hair loss on the ears, been like that for a month and hasn't gotten any worse, and no other pets are experiencing this symptom. Let's see. So probably I would watch that. You know, if the skin looks perfectly normal, and it's not changed in a month, you're probably good. So there was another question. Very unlikely to be mange. The mange of the cats get on their ears really, really super itchy, very crusty, and very contagious. So think you're clear on that one. Let's see. Okay, so here's another question. If your dog throws up a few minutes after giving them their flea meds orally, should you give another? Okay, let's look at the time frame. If it's a few minutes, first, did the dog throw up the pill? If it did, you can give another. I would wait and probably give it with a meal to lessen the likelihood it'll throw it up again. And that's kind of a time-dependent thing. If you've given it and it's been an hour or two and then the dog throws up, you're probably good, because by that time it will have passed through the stomach. Things will have been digested and absorbed. So, you know, if you're super in doubt, you can, always, call your veterinarian office and see what they, okay. The cat. I have helpers. I always have helpers. Although, let me say, meow. Oops. I was trying to show you my sleeping helpers. See, they're just crazy dogs. Anyway, how effective are flea collars at keeping fleas off your pet? Ooh, I like that question. Another soapbox issue for me. Okay, there is one. Pardon. There is one and only one effective flea collar on the market. That's the Seresto collar that's available from your veterinarian. Please, please, please do not put flea collars, over-the-counter flea collars, on cats especially. Dogs either, for that matter, because they don't work. They're just not effective. We've got so many better products out there. I'm surprised they sell flea collars. So the reason I don't like flea collars on cats, other than they don't work very well, if at all, is that they have been shown to be a risk factor for developing oral cancers in cats. So if you bring a cat in with the flea collar on, you can bet I'm taking it off. I'm not throwing it away. I'm taking it off. If you happen to have a vacuum cleaner with a vacuum bag, or even like I have a Dyson, so I could use it that way too. But you can cut up your flea collar. Here's how I used to tell people: take this flea collar, cut it up, stick one in your vacuum bag so that anything you vacuum up, if it is going to die, and you can put other pieces like under your couch cushions and stuff. So, it's not a total waste of time. But if you're talking about on the animal itself, there's much better options than flea collars, and safer. All right. So I think we're good. We made it a half an hour. Woohoo. So, okay, I'm giving you my usual COVID-19 warning. Please, 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 please. Social distancing. Stay home as much as humanly possible. If you go out, wear your mask. Really, this country has not had any experience with infectious disease. We're spoiled beyond belief. We're a well-vaccinated first world country. So I understand why people are having a hard time with this. But really, let's take one for the team. Team USA, Team Planet. Let's stay home. Let's do the right thing. Wash your hands too. Please wash your hands. Okay. Be safe, everybody, and I guess that's it. Bye.